good. Okay. Good evening, everyone. Thank you for joining us and accepting the invitation and making the time to come. I know it's been a long day for some of you and really appreciate you taking the time. Tonight we are having hopefully what will be the first of maybe we'll talk about future ongoing intergovernmental conversations around this topic. But we really wanted to invite you to a conversation around health and wellness in Flagler County. So mental health, of course, is a huge component of that, but it's really a broader picture. And so the last time that myself, Carrie, and Lynette Schott from the school district came to visit your different elected bodies, we shared with you the community needs assessment update and some of the information contained in that and gave a brief overview about suicide in our community. What we're doing tonight is going to provide you with an update. That survey is done every 3 years. The hope is to give you an update on that survey, talk about some health and wellness metrics that we can all kind of agree upon that might be important to developing a report card of some sort or a dashboard. Carrie will go into more detail about that, but we hope that in the process we'll be able to share with you and the community and each other some of the things all of us have done since that time period over the last 2 to 3 years in regards to health and wellness. And then talk about how we can move forward in what we might be able to tackle and address as an entity for each one of us. I really want to thank the mayors and Commissioner O'Brien for joining in that invitation to welcoming the other intergovernmental and elected officials to come to the table for this important topic. And so I'm going to turn it over for some welcoming remarks from Commissioner O'Brien, and then we'll go around for quick introductions.
Well, thank you, Colleen, and thank you, Carrie, for agreeing to facilitate this evening. It's extremely helpful. And thank you to staff for helping us do the logistics and get all this put together. Sure appreciate it. You know, your participation here this evening is evidence of the fact that you care very much for and you're committed to improving health outcomes in all of our communities and for the betterment of our citizens. And I thought about this, you know, the issues and the challenges that we face as a community, they don't recognize boundaries. They don't recognize that, there's any separation. Drug addiction issues, mental health issues, suicides, they happen in all of our communities. They don't just happen in Bunnell or Palm Coast or Flagler Beach. They happen everywhere. And so I look forward to us having a good conversation this evening, and I'm excited to join you to get to work on us trying to work together to solve some of these issues and to generate good ideas and activities for the betterment of our community. So thanks.
And we have just about every elected body represented. So if we could start at the top of the table and maybe just go around quickly, share your name, title, position, and what entity you represent.
Doug O'Connor, Beverly Beach Town Commissioner.
Catherine Robinson, Mayor of the City of Bunnell.
Eric Cooley, Commissioner, City of Flagler Beach.
Marshall Shoup, Commissioners, Flagler Beach.
Kim Carney, Commission Chair, Flagler Beach.
Linda Provencher, Mayor of the City of Flagler Beach.
Charlie Erickson, Commissioner, Flagler County.
Dave Sullivan, County Commissioner, District 3.
Donald O'Brien, County Commissioner.
Colleen Conklin, School Board.
Paul Bovino, I'm the Investigative Chief at the Sheriff's Office.
Andy Dance, School Board.
Jack Howell, Palm Coast City Council, District 2.
Jerry Forte, Fire Chief, City of Palm Coast.
I'm Carrie Baird with Flagler Cares.
Excellent, perfect. So Carrie, I will introduce you, at this point in time. And for those of you who don't know who Carrie Baird is, which would be almost impossible, but for those of you who don't know, Carrie is the Executive Director of Flagler Cares and has been a longtime advocate, actually, for youth mental health issues, and very involved in this area of community needs, and works with and has worked with Volusia County, and has worked with Flagler County for a number of years now. So we're very grateful for your expertise in this area and for guiding the conversation tonight.
Great.
And
Well,
thank you.
thank you for the opportunity to share with you our 2019 Community Health Needs Assessment and the health priorities that emerged from that process that we've spent over 8 months working on. And this will really be our third cycle of looking at data, collecting information from the community, and identifying priorities across all of the issues that could be encompassed with health and wellness. I'm going to share a little bit of information about the process, and I'm going to go through some data. We have a little limited time tonight, and I don't want to overwhelm you because the book is, this thick. So I'm just going to give you highlights of our health priorities. This is what the document looks like. You can find it online in a variety of places. Our hospital partners, the health department, Flagler Cares, any of our websites, you can find the full document. It included 3 main components. One was a county health survey that was done, and it was a survey done in Volusia, Flagler County. We had 2,000 Volusia residents and almost 1,000 Flagler residents that filled out the survey. We looked at statistical data that's available from primarily government agencies that collect information about health, wellness, water, death, basically any measure that you can think of related to health and wellness, over 300 indicators that we looked at. And we had a leadership team of individuals who looked at that data, added context to it, their expertise in a variety of areas, and helped us identify the health priorities that we wanted to focus on for a really comprehensive and collaborative effort for the next 3 years. So from 2020 to 2022, we're building right now a set of strategies to implement and create change in our community. So these are the issues that emerged in Flagler County. So adult behavioral health, which would be substance abuse, mental health, tobacco use, youth behavioral health, cardiovascular diseases and diabetes, and connected to that too, healthy lifestyle. So healthy eating, physical activity as a precursor to chronic disease. Mothers and children under 5, and family violence, which includes domestic violence, child abuse, and neglect. And we also discussed as a leadership team that with all of these priorities, a special concern for really vulnerable populations, social determinants of health, people who have lower education, lower income, have been exposed to trauma, are more likely to have all of these health challenges than other community members. So really focusing our strategies on high-risk people who have challenges with social determinants of health. So mental health and substance abuse is obviously a really significant concern. It's been something that Flagler County has been, I think, really talking about, grappling with how to address our mental health need. Until recently, we had the highest suicide rate in Florida. A lot of community concern about that. And some of the indicators that when we looked at how our trends in Flagler County were moving or how we compare to the state we were concerned about include binge drinking, alcohol suspected traffic crashes, chronic liver disease and cirrhosis, opioid drug overdoses, tobacco use, poor mental health, and suicide. So those were all indicators that helped us prioritize this because either our numbers weren't going in the right direction or we were significantly worse than the rest of the state. Again, with youth behavioral health, one of the challenges is most individuals who suffer from mental illness throughout life, they started having challenges in adolescence. So it's really an opportunity to do early intervention and get people services that they need so that they don't have a lifelong challenge with alcohol and drugs and mental health. So some of the indicators we looked at that prioritize this issue: alcohol use, marijuana use, cigarette use, e-cigarettes and vaping has gone the trend has gone really high recently. Suicide and out-of-school suspensions as a proxy for behavioral challenges. Cardiovascular disease and diabetes. Again, heart disease, stroke, and diabetes account for 30% of our county deaths. And again, tying that healthy weight and healthy diet as a precursor to chronic disease. Our heart her heart failure hospitalization and death data had poor trends, stroke hospitalization and death, diabetes, physical activity, obesity, and overall premature death for Flagler County. For moms and children under 5, we looked at, I didn't change these indicators, did I? So we're looking at things like infant mental health, poor birth outcomes, women who don't engage in breastfeeding, some indicators like that. And with family violence, we're looking at child abuse and domestic violence rates, and the number of children in foster care. This is some data that I think really helped the leadership team look at all of the indicator data in context. So this is one of the results of a question that we asked in the survey. We did an online survey and also paper surveys at certain service delivery sites. And we asked the question, check up to 5 health issues you're most concerned about in the county. And you'll see mental health problems was number 1. Almost half of the respondents said that that was one of their issues most concerned about. Addiction, either alcohol or drug use, homelessness, unemployment, child abuse and neglect, and motor vehicle crash injuries were the top 5. And similarly, we asked them, what are the healthcare services that are most difficult to obtain? And you'll see again, number 1 was mental health counseling. Again, almost half of the respondents said it was very challenging to obtain those services. Alternative therapy, substance abuse services, specialty doctor care, and dental and oral care. So those were all gaps within our health delivery system that were identified by the respondents. I'm going to quickly go through some of the data, and I'm going to kind of watch your faces to see when it's too much. So I may move a little quickly. We can always go back if we want to refer to some of this as we have dialogue. I mentioned again that there were some key indicators where you can see the arrow. If the arrow is going up in red, that means the trend is going in the wrong direction. If it's up and red, that means we're higher than the rest of Florida. And if data is available, we had the number of individuals impacted, so you can kind of see the scope of the problem in the community. So again, these were the issues that we looked at as challenges. You can see the alcohol suspected motor vehicle crash rate is going up and higher than Florida. You can see it kind of jump there. And you have to be careful when you look at graphs like this, because sometimes the overall incident is a small number. So in a community the size of Flagler, sometimes the line jumps around a lot. So you want to look at it over time and compare it to the state. Chronic liver disease and cirrhosis, again, Flagler County is a little higher than Florida. Opioid overdose age-adjusted death rate, we are increasing there. So we're not as high as the rest of Florida, but the rate is going up, which is of concern. There's data for adults who are current smokers. This is a national survey called the Behavior Risk Factor Surveillance System. And you can see that women and non-Hispanic Black individuals in Flagler reported smoking higher than the rest of Florida. We looked at, again, that same national survey, the number of adults who had poor mental health on 14 of the past 30 days. And you can look at the different rates there for different groups. When we look at the 18 to 44 population, we're higher than the rest of Florida. Those individuals with lower income are higher than Florida. So depending on what subgroup in our community you fall in, you're at higher risk there. The suicide age-adjusted death rate, again, Flagler is significantly higher than the state of Florida statistically, and the rates are increasing. So with youth behavioral health, there are a variety of indicators we also looked at. A lot of this data comes from a self-report survey that's been done for over a decade in Flagler County schools. They ask kids about their drug, alcohol use, risky behavior, things like that. So you see here that in Flagler, for middle school students using marijuana in the past 30 days, the rate in 2018 was higher than the rest of Florida. And also increasing there for high school kids and higher than Florida. I mentioned earlier the vaping rates. We only have this data for the last 2 survey cycles, but the number of kids who are using e-cigarettes is really pretty startling. It's the first time that tobacco use overall has increased in the last 20 years. So there's a lot of attention around that. The suicide death rate for kids aged 12 to 18, Flagler again is higher than the rest of the state. And out of school suspensions, we're higher per capita than the rest of Florida. For cardiovascular disease, again, we're looking at heart failure, stroke, diabetes, obesity, physical activity. And you can see here that Flagler heart failure death rate is higher than the rest of Florida. Congestive heart failure hospitalization rate is also, for Black individuals, significantly higher than the rest of Florida. Stroke hospitalization rate, again, there's some disparity there with Black individuals. Same with stroke, age-adjusted death rate. This is that same national survey data about adults diagnosed with diabetes. We have 13% of our citizens have been diagnosed with diabetes. And premature death, this is a calculation where you look at when people die and what the age expectancy is. People should live to be 75. So you can see an uptick in individuals in Flagler that have died prematurely based on that calculation. Some mothers and children under age 5, teen births, STDs, low birth weights, births with no prenatal care, looking at some of those measures. You can see births by age 15 to 19, so teen pregnancy. And these numbers have started to go up and are higher now than Florida. And this is a newer trend here in Flagler. You've got some STD data, again, where we're trending up. Births to mothers with no prenatal care. The numbers are low, but we are going up. It was 1.1 and now it's 1.7. Births to mothers who initiated breastfeeding, which is a healthy measure for us to look at. Again, the rate has gone down in Flagler the last 2 years. School readiness at kindergarten, you can see only less than half of our kids scored as being ready for kindergarten when they entered school. The number of kindergartners fully immunized is decreasing and lower than the rest of Florida. And children in school readiness programs, you can see the Flagler rate is quite a bit lower than Florida. So kids aren't accessing that early child experience. Family violence, we're looking at domestic violence rates, number of kids involved in the child welfare system. So domestic violence offense rates are higher in Flagler than in Florida. They have gone down, and I believe they've significantly gone down since this last measure here, 2017. Children experiencing sexual violence, ages 5 to 11, you can see the trend up there and higher than Florida. Infants in foster care, again, that rate is going up, and we're now higher than Florida. When you look at kids age 1 to 5, that same trend. Oh, I went fast. Any questions about any of the data, or would you like to look back at it at all? Are you surprised?
I think it's probably helpful to note that the date on some of the data is lagging. So you'll notice there's different dates, and I think all of it has been identified in the PowerPoint, what the dates are of that data. So some of it we'll watch to have that updated. And when we start talking about metrics and data available, that's also an important part of the conversation, is how often is the data available and how current is it?
Yeah, and unfortunately, whenever we publish a document like this, new data comes out. So
Right.
In an ideal world, it would be something that we're constantly refreshing and that it's online, not something that you print, so you can look at the most recent data.
Well,
So-
Carrie, I spoke to John Finelli yesterday at the school board. There, he's hiding back there. And he gave me some good info with regards to the increasing incidence on vaping in the school. And just for your knowledge, I'm in the process of working with our city attorney to produce an ordinance that will prohibit the sale and distribution of e-cigarettes or anything relating to vaping materials throughout the city of Palm Coast. I'm going to nail these people that are selling this stuff.
Can I
Sure. Piggyback this morning, Terry Williams,
Yeah.
SWAT team and all. We were at a forum up in Jackson, or up in, at the World Golf Village. And she has a lot of information to share. She
Right.
was going to be here tonight, but I don't see her here
Well, I had
yet.
talked to her yesterday, so.
Well, she has a
yeah.
lot of information to bring to the
And
table.
the other thing that we're doing is, I'm trying to come up with a lawsuit from the city against the manufacturers of opioids, joining in with the Orlando lawsuit. We've got roughly, I talked to Sheriff Staley yesterday, and it's costing us money just on our suicide, about $3,000 per instance, where the investigative time, the CSI guys and ladies that are doing their thing, and I'm working with the coroner up there in St. Augustine.
We have full detectives and CSI responding to almost every overdose that
Yeah.
results in a death now or suspected death, which we weren't, years ago that didn't happen now, because
Exactly.
we're investigating every one of these deaths as a suspicious death now related to the narcotics.
All right, so we're gonna, we gotta make a statement.
So Colonel, you brought us right into the next agenda item perfectly. I would think you were a plant almost, but you're not. We wanted to share and kind of open up the floor for a little bit of discussion about what kind of things you've been able to do as an entity to address mental health or wellness for your organization, right? Your, who or whatever you might represent, whether it's a city or the county or the schools. Carrie is also, and in your handouts, you'll see, because there's a lot of things that happen that we may not even be aware of, that are taking place, and that are initiatives that have been started. And so Carrie's done a really great job of tracking down, and it's this spreadsheet that you'll see. And it's basically for the benefit of everyone here, but also for the community, to kind of share some of the things that have been put in place and some of the initiatives that are being worked on to address a multitude of issues and topics. So Carrie, I don't know if you want to walk through or open it up, right?
Oh, I do have a copy. Sure. So this was an update that was done at the end of 2018, so we still have other information to add to it. But it's based on the community health improvement plan that was done during the last 3 years. So there have been quite a few successes and strategies that are really ongoing, outreach, education, things like that. One of the strategies was to increase the capacity at SMA Healthcare here in Flagler County, in their Bunnell office, to do a whole system where individuals in crisis can go there and have a local place, and if they need to be hospitalized or taken to Daytona Beach, then they're transported, which saves the sheriff and his staff time to do that. And they were able to get quite a significant amount of funding to sustain a program that they started with a grant. So that was one success that we had. We did add a new mental health service for kids that's really intensive services. It's called a CAT team, and Halifax Health has a CAT team, which was a new capacity, serves Volusia and Flagler counties. There's been quite a lot of growth in the school system as it relates to youth, substance abuse, and mental health services, new capacities to really identify problems as early as possible and quickly get kids into services and their families into services to help address those issues.
And I'll be the first to say up front that a lot of times when you are looking at initiatives where you want to tackle some of these pieces, they require resources, right? I mean, they just do. We are fortunate at the school district because the state, after Parkland, unfortunately and tragically, but after Parkland, they did put in additional dollars for mental health, which really allowed for us to revamp our whole entire mental health approach in the school system. But again, it takes resources. So we were fortunate enough to have some of those resources to do that, and a leadership team that really worked hard to address some of those issues. But there are many things that have been put in place, so we wanted to share those, but we also wanted to hear from you about different things that you may be doing if you wanted to share, and if they're not on the list, or you wanted to highlight, that would be great. We know the Sheriff's Department has done an awful lot with domestic violence.
Yeah, we just had the DV Summit, and we were speaking about that. And I think what we came up with in that DV I had mentioned there was, DV was not something that we could do a proactive approach on. I mean, that we don't know when someone's going to batter their spouse. But what we've done is we've now really focused on it to where these reoffenders are being identified before they reoffend or possibly hurt someone or kill someone, in a larger scale event. So now we have a DV detective assigned to that and an analyst who are constantly watching these offenders, and if they can violate them or, enforce against them before they get out or offend again, they're doing that. And we've never done that before. So we're looking at a very much more proactive way than we ever had before. So it's working. Our numbers seem to be decreasing now, but DV is a very fickle thing. I mean, that's not something we can go, that's not like burglaries where we can target an area, put manpower there and reduce crime. That's just something that's very, close to a household and relationships. But we are making an impact. I feel like we are.
Chief, there's no way to know what's not reported too, right? I mean, there's just,
Of course.
that's such a hard.
By the time any of these events affect the sheriff's office, we're reactive. I mean, this is all reactive to us. We are there when the situation is probably bad, whether it's mental health or domestic violence or substance abuse. By the time we get involved, there's a reason why we're coming. It's probably pretty bad at that point. So for us, reacting to these things is really, we can't really, it's very hard to be out in front of any of these topics
Right.
for us.
Right. Anybody else want to share?
Yeah, I'd like to bring up a few points. Both Chief Bavino and our personnel, Flagler Beach personnel, we're always there after the fact, and we're picking up the pieces. And one thing that has been lacking in Palm Coast for about 25 years is we've worked on fire stations, fire equipment, staffing, locations, but we never concentrated on the employees themselves, on how all these calls actually affect the employees. And our focus for the last 14 months has been inward and on the employees. One thing that we need to consider is these tragic events happen all the time, and the people that respond to them all the time end up bringing this baggage back to the station with them and bringing it home. Our focus for the last 14 months has predominantly been on the body, mind, and soul of the employee. We've got peer fitness trainers that are now in the department, and we've just received a grant for $150,000 so that we can bring physical fitness into the organization for the employees, which is one part of that three-leg stool. The other part is cancer awareness, and the other part is mental alertness. The mental aspect of our job has been gone unchecked because of the stereotypical, this is what the job is.
Right.
In 14 months, we established a chaplaincy program that allows one of our employees who is a trusted member of the department to go around once a month and visit with every crew member just to make sure that they're okay and they take their temperature, they gauge their outcome. Anytime that there's a significant call of consequence, the CISM team, or Critical Incident Stress Team, is made up of 8 members, and somebody is on duty every day that is aware of when the calls go on, and they get to take the temperature of the employees that went on those calls, and they get feedback, and there's immediate assistance there for them to have conversations. The chaplaincy program plus the CISM program helps coordinate what the mental health aspect is of the employees so that when they come back from the calls, they don't no longer take it home with them, and now there's work done at the station. This is completely confidential, and it's away from administration. It's a peer-on-peer relationship. And I encourage all the people that respond to these calls to develop their own program and to develop it in depth so that these folks have an avenue that they can go in. The problem doesn't end at the station, it goes home.
Right.
And our gauge is if they have a bad call, we try to decompress it at the point of entry. At the end of 3 days, when they return to shift, they come back and we figure out how they're doing. We've opened up communication with the family members to see if they're okay at home. And if they're noticing something unusual, they've got people that they can contact and let them know too. We're missing the focus on employees. Just recently, yesterday, I believe it was, Orange City lost a deputy because of this is the type of incidents that we're finding out in the field. This is what we need to bring to the light. If we're going to keep addressing these issues out in the field, we've got to consider our first responders as first and primary that have to deal with these things over a long period of time. And it doesn't end when they retire. It stays with them.
Yeah, right.
So, we've had a lot of focus internally on our department and how we're going to operate. We most recently, last week, had a speaker come in, Dwight Bain, who is really good at decompression and mental health. Once a quarter, we do significant training. We instituted the chaplaincy program and put together a phone line that someone can call anonymously, and if they have a concern, they can do something about it. We did that at 8 o'clock on a Friday night, and by 8:15, we had someone call in and say, I don't think I can do this anymore.
Wow.
The first month, 3 firefighters were treated for mental health. And that was both heartbreaking and reassuring that they trusted the system. It's leveled off in the last 6 months with constant interaction with the crews, but if we ignore this, our first responders will be affected by this in the long run.
Okay. Excellent. Thank you
Yeah,
for sharing that.
You know, a lot of people don't understand. There's another part to that. We were just talking about the criticism from outside people towards somebody having an issue with PTS, and then all of a sudden, well, you're a wuss. Now, I'm 100% disabled from the VA because of traumatic stress. I killed a hell of a lot of people in my career in the Marine Corps, and it's come home to roost. And the worst time that it came home to roost was I was in a motorcycle accident a couple years ago on US 1. And I'm laying on the side of the road. Charlie was there. He remembers that. He's trying to text me
You didn't
saying,
want to take that damn leather jacket off.
my flight jacket, yeah. Hey, I thought I was back in Vietnam. It was as real as it could be, and I was a basket case for a month. Now, the bad part of this is, yeah, I'm in the VA system, and the VA system quite literally sucks. They don't have enough health care providers to handle us. It seems like every other month, there's a new doctor. And I noticed when we were looking on our statistics here, one of the problems that is held in our community is we don't have mental health care people.
Correct.
You know, they're hard. And I can tell you that I've gone through one marriage because of PTS, and as a career military officer, we couldn't say anything. Even to this day, God forbid you go to your command and say, I'm having an issue. Well, yeah, they'll take care of it, but they'll pull your security clearance, and you're done. You are out because you can no longer be effective. That's how they take care of that stuff today. It's a continual thing. So what do? Well, you run your tail end off doing PT, and you become a workaholic so that you can compartmentalize your issues with post-traumatic stress. And I'll tell you, my nemesis, and this will help, was a picture of a little girl on the cover of Time magazine running down a dirt trail who had just been napalmed, and you all remember the picture. When I saw that, ding ding, I knew while I didn't do it to her, I know I had to have done it to others with the amount of ordnance and napalm that I dropped. And that was sealed, and if she's here, she's a part of my life. I keep her in a box. I don't want her out because it's nasty. And that's the hardship that you're dealing with. I had kids in Ocean Rescue in Jacksonville, 16, 17-year-old kids that when we had a very serious incident, I immediately know that I had to go into crisis mode and sensitize the issue. Let's go over it. Let's talk. I'm dealing with a 16-year-old girl that saw her first infant drown. And I didn't have time to work with her. I said, here, you take care of the parents, I'll do the CPR. And fortunately, I got her through that. She's a commander in the Navy right now. But this is real. I've been there, I've done that. I've smelled it. I've lost loved ones because of this. And I know only, that the society doesn't give us credit. They don't understand the things that you see, the things that you've done. Paul knows. He investigates. He scoops up, like I did, the pieces, and we transport. But it's a very bad situation, and we just don't have the assets to address our need to help the people that are suffering.
So, Colonel, I think you bring to light a couple of different, very critical points, right?
Yeah.
One is the stigma around asking for help. And that crosses all demographics, and especially impacts our first responders, because they're the ones who help, not ask for help, and our veterans.
That's right. You're not allowed to have emotion.
Right.
You can't show it, or that's weakness.
But the stigma, really, there are multiple individuals who are impacted by the stigma of asking for help and mental health. So the big question becomes, how do you attack the stigma around asking for help? And, you know, we've tried to couch that conversation in changing the dialogue and how we approach mental health. That if you had a heart condition, you would get your heart checked out. And you would ask for help and not think twice about it. And so some of that is changing the conversation. But some of that is in developing or sharing information about resources that are available, that people can ask for either quietly or confidentially, but really trying to help them deal with the stigma in itself. The second part that you identified, which we've heard, you know, from multiple individuals, and many of you sitting around this table can probably speak to that, and that is a lack of resources here locally, especially for those who are uninsured or have Medicaid. There just are not the providers here locally. So as a group of elected officials, is there anything, and I don't pretend to have the answers to all of the questions, but are there things that we can do to address the issue of access to resources? Or are there policies we can look at for encouraging, you know, business owners, mental health business owners who are looking to come in? Are there, just like we do with businesses, we provide incentives to a corporation or a company. Can we provide incentives to, you know, entities who are willing to take Medicaid patients, or counseling and offer mental health counseling, or other organizations that help in deal with many of these issues?
You're right, and of course, one of the things that I had to do was to go on for an advanced degree in counseling, and I'm a member of the American Academy of Experts in Traumatic Stress. So I do a lot of counseling, okay? But with the work that our mayor has done in bringing in the Flagler Health Village program, if it gets off to where it should be, they're going to have some mental health. But again, if the mental health providers aren't out there, they're not coming.
Right, but the question is, can we develop incentives as a community, right?
That's right.
So I want to give does anybody else want to share anything else that their entity or their organizations have been involved in or doing?
I'll speak to recovery in Flagler County. I've been working with Mike Feldbauer, who has made a connection with the, I'm going to say this wrong, but the Florida Alcohol and Drug Addiction Council. And through basically we all met through the opioid task force, but the Flagler County was chosen because of the fact that they were dealing for as little as we had gotten with the opioid task force to be a model for a recovery community organization. And it's very organized. We just had our symposium in October. We had 120 people from the community there. And the goal of the symposium was to identify 9 areas for our community and what's lacking in our community and what recovery looks like in our community and what our statistics are. Well, we did all that. And we did roundtabling, we came up with gobs and gobs of flip charts, and now we're bringing it all together. And it's called a visioning meeting. And the visioning meeting is where we'll set committees, and there'll be a committee for bylaws, 501c3, whatever this organization is going to look like in Flagler County, only Flagler County can identify what the committee is going to look like. They don't come out and tell you what you're supposed to do. It is funded. One good thing about it is we get $5,000 to fund it from the state of Florida because we said yes. We used some of the money for the symposium, and then we have to raise funds in order to become a 501c3 and whatever else it takes to become a recovery community organization. That ultimately will be a resource. We heard it today. Somebody overdoses. They make their way to the emergency room saves their life, and off they go back into a community that will not behold them, will not help them, just has no resources for them. But, you know, the hospital did their job. If you had a peer sitting in that ER, somebody's been there, done that, the recovery picture is phenomenally changed, so that saved person is going to go through withdrawals. They're going to go through a whole series of medical condition to get them into being dry.
Well, that's one of the needs, right? We don't have a
Exactly.
detox center, so.
No detox,
Right.
no peers. Hospital, again, you have to change the whole outlook in the ER. Will you let people in that don't wear a badge? Will you let people in that have to clear security? They have to go through this whole 1-year peer specialty training, and they can have no background check. Well, what peer does not have a felony? I mean, the whole system's broken, but once we get through that, then we have no place to put them to come back to Flagler County, and then they have no jobs and blah, 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 blah. So this recovery organization, we hope and pray, will bring some light and shed some light on. Right now, it's community, all volunteers. There's no director. There's nothing like that. But in other communities, I mean, one community, they have actually built a building and have all the resources in one building for how to get that person or those people. They do not deal with children, most of them. It's mostly adult. And right now, it's all recovery mode. So you might have seen Volusia is a little bit ahead of us in their program, and we're a little bit ahead of St. John's. So in between, these 3 counties have been chosen for model recovery organizations. So the next meeting is December 10th. We don't have a location yet, but that is where the actual boots will hit the ground, and we'll start making something happening, hopefully here in Flagler County.
Commissioner, are there any models around the country where this is
Yes.
working and successful? Anywhere in Florida?
The Florida program they're the ones that picked it up.
Okay.
So the state of Florida put it through their council, their Drug and Alcohol Abuse Council is the one that's seeing it throughout the whole state of Florida. There are many other areas, Pinellas. The thing about it is every community has different needs, so you really have to do it within the community. But the concept of community, recovery community organizations is all over the county, all over the country.
Anybody else want to share anything? Okay. Again, the 3 or 4 page list that you have in front of you, you will see different initiatives that have been put into place, where they are, whether they are ongoing, whether they are achieved, whether they're working on, you know, what the progress is. And you'll also see the entity that has taken the lead and who's being impacted by it. So we just wanted to make sure you were aware of what is happening in some of these areas, because we all kind of focus on our own area, and we sometimes lose sight of what everybody else is doing, so we wanted to make sure to share that. And so we'll keep moving on to the next agenda. I'm reading my cues well. Okay.
So the next thing we wanted to talk about is if we were to create a report card for Flagler County, something that we could look at data hopefully more regularly than annually, and that there isn't such a lag to it, what would be the measures we could use to know whether health and wellness in Flagler County is going in the right direction, if we're making progress on the issues that we looked at with data, and that our strategies that are in implementation are making a difference. How would we measure success?
Usage, that's the biggest thing, you know,
Okay.
how many people that we have in our community are taking advantage, are actually using the system. That's your report card that, A, the word is out about the services, B, people are using them, and your numbers should be constantly rising. as the
So,
word
Colonel,
spreads.
can we flesh that out a little bit? So are we thinking services as in Halifax Behavioral, Baker Acts?
Any number of these things, you know.
Stuart Marchman?
Anything that a person is in need of, whether it's on the drug side of the house, or if it's with prenatal, or if they're having issues with smoking and they need special counseling. You know, the whole gamut of the services that we're trying to have available for our citizens has to be measured in terms of usage. Because if there's very little usage, then you gotta look at your return on investment. And, you know, is this not needed then? If you're,
Okay.
you know, that's where I'm going with that. That's a big indicator.
Okay.
So we could reach out to the agencies that have service capacity and identify how they measure their usage, their waiting lists, things like
Well,
that.
not only that, but that's directly tied to their budget. So they have to have that data to justify increase in funding or to maintain funding.
Okay, usage.
Yeah, I learned that at Harvard.
You're so smart now, I can't
I
handle
know.
it. Any, you know, when we had this conversation, I'll throw out the one that I was thinking about, and it's, you may not think about it, but foreclosure. The number of foreclosures we have in our community, the number of bankruptcies that have been filed. I mean, if somebody is going through a hard time, if they're being foreclosed on, if they're going through a bankruptcy, you know, those may be individuals that are struggling and just treading water. What other,
Baker Acts.
the number of Baker Acts?
I think too, you know, the sheriff and our other law enforcement bodies have an opportunity to look at arrest and offense data in a much more fresh way than you look at when you collect it from FDLE and you look at it.
We do every week.
Right.
Every Wednesday, we
Right.
meet on our crime data. We meet on our DV data. We look at all those things. We look at things that we can do things about. You know, the stuff that we can proactively do things about. Some of the other stuff, I mean, we can't. We look at traffic fatalities. We look at things that we can impact, try to impact, and we do that every week. So the numbers are fresh, and we try to craft a plan that week, you know, to judging on what's coming in and impacting us at times. So we are doing it in real time every week. We call it focus subjects, focus locations. Like, we are focusing on what is impacting us on a weekly basis when it comes to that kind of, those kind of topics. Baker Acts, I have always felt, I've been a sheriff's officer for 24 years, I read the commander's reports, which is our briefing logs for the day, and I really feel that we have a lot of, I mean, we see a lot of Baker Acts, and I just don't, it doesn't seem like we should have that many Baker Acts, but I read them every day, and I'll read multiple in a one shift report, and it does startle me that we do have that many Baker Acts. Now, we are, you know, the colonel said it, I mean, we all said it, we have a lack of voluntary places to go to get treatment or do anything here, and a lot of times it falls back on us then when we get to a situation, and then we have to do that because the people aren't, either they don't have the money, the insurance, or the facilities to care for themselves or to get someone to care, so they rely on the law enforcement, you know, and then sometimes we do that. And but I do feel like we do have a lot, you know, that would be my feeling, you know, saying I could certainly produce numbers, but I feel like that.
Andy?
Well, the opposite of Colonel Howell's comment is what Chief Bovino mentioned, is the gap. So if we can start identifying the elements that are missing, the gaps that are there, and start to track progress on those on a year-to-year basis.
So can you give an example?
I think what I heard at the Intergovernmental meeting from Jill Crawford was a list of some gaps in services and areas that were missing. So I don't have her speech memorized, but there were a number of things within that.
So what Mr. Dance is referring to is Jill Crawford had mentioned, having Medicaid, there are no Medicaid providers for someone who needs to see a psychiatrist. The list of services that have been identified for Flagler County residents, the bottom line is some of those services are just simply not available. Or they're available out of county, and so you have to travel for those services. So access. We go back to the access issue again.
I think another indicator here that is very important is the number of suspensions in the school system. That's an indicator, depending on what the issue is, and you take a particular student and it's starting to develop a history. All right, of course now, today we're all focused on the school shootings, and certainly those are flags that you want to look at, but you need to look at the whole gamut of situations that take place in the school and what were the cause of these things, bullying, all right, and then the fight back. Back in my day, if I came home and I was bullied and I didn't take care of myself, my father would whack me upside the head. And then I'd have to go back and tend to business again, that was the way it was.
So definitely, the number of suspensions and out-of-school suspensions I think are important. But there's a new data point that the school system has started to track, which is about trauma. And it's in partnership with the Sheriff's Department. And really, John really tracks students who have been involved in trauma. The night before, there was a domestic violence situation, there's 3 children at home, and they need services. They've been a victim of trauma of some sort. And so we've started tracking that, and that would be an indicator that might be really wise to watch.
Well, you're right.
Because if you don't deal with the trauma as a child, then we're all probably in agreement that that child is going to grow up with that trauma.
Well, you're a victim of what you see, and I will, I'm an old man, so I've had a lot of experiences. And one of my experiences is I did work at one time for the Division of Children and Family Services. Actually, I did it twice, in South Florida and up here in St. Augustine. And the DCF, or the DCS, or whatever you want to, they have got so many problems that the caseworkers just can't handle it all and do it justice. And that's another problem. And you're exactly right. Paul has seen it when he was on a patrol side of the house, and you're answering a domestic disturbance. The kids are all basket cases. They're petrified.
Sure.
They don't know what's going on. And next thing they know, they may be removed, stuck in a foster home. All of this stuff is scarring that kid. And then somewhere along the line, if we're not careful, it's going to boil over.
So
And we've
When
had,
John had started that, like the Colonel's saying, with our guys, and it's called Handle with Care.
Yeah.
So we have a Handle with Care email, but what I fear with the Handle with Care, you might see them go out, and I see them in the commander's reports. The deputy will say, I sent an email to Handle with Care for the kids, and it's great, because that is a fantastic thing to know that this kid is coming in with some kind of traumatic event that has happened, whether it be, they might have just witnessed, we had it where the kids were on the bus and there was that electrocution. Like, they had saw those people laying on the ground. Like, you just don't know how all the kids on the
Right.
bus responded to that. And that's like kind of a unique situation there, but it could be the domestic, it could be the overdose, it could be anything like that. But I do feel that I don't think we're catching every one of them. I know we're not catching every one of them. Deputy sheriffs are handling these dozens of calls a night and day, and they're not always. That's something that he or she has to remember to. Oh, I'm gonna make sure I hit that handle. I wish it was more automated, or could be caught better. And I've talked about that in a couple of those forums, and I just kind of put our minds together to see how we can make sure that we're not missing those kids. That could be the difference between them acting out in a violent manner at the school or in a different situation, or them becoming a victim of something else or having a traumatic event. I think it's an extremely important program, and I wish we could make it more robust and figure out a way never to miss these kids when, because we're seeing so much. The stuff we're seeing now, you know, it's a lot.
And let me just throw one other thing on here. I've always been concerned when I was in that role as to who my foster parents were. You know, my emergency parents, when you had to make an immediate placement. Because you have some people out there that are unscrupulous, and in some cases, they're worse than the situation that the kid just left.
So is that an indicator we should be looking at?
Oh, yeah.
The rate of foster?
Yes.
Children foster?
money.
Yes, sir.
I have a question, I think, for Commissioner Carney as well as the board, I believe. There's a lot of confusion before the sheriff's office gets involved and before our crews respond. The confusion is people don't know who to call or how to get in touch with somebody to get help, which is why a lot of the calls are going up and the responses are going up. And it's almost as though that there's no one-stop shop, I gotta call somebody and get the direction. Simply by looking at this list of a lot of folks, and this is not the list of the people that are trying to do good things, that's not even attached to this group.
Correct.
There's a lot of folks that want to do good, but they have no way of doing it, and they're spinning their wheels. And it almost seems as though if we have all the good intentions, but if we don't have a focal point, such as like you would see in an hourglass where all the sand goes through one point, we've got no way to capture who wants help, who needs help. And instead of redirecting them to a different phone number, people have a way that they can self-help without legal intervention with the law enforcement or worrying about getting Baker acted. Maybe their circumstances are not as significant and they can get it small. And I think the confusion on the front end is leaning towards who do you call? Well, 911 can fix everything.
Right.
And I think that's one major warehouse where everybody can go through to get the answers.
Chief, having like a call center or something like you're saying, like that's what I envision, like, you know, they call dispatch, that's who they call, and they then, of course, me and Jerry, you know, our guys and girls get all those calls that come in, and we do have to go figure out things that are not in our realm of anything, and we have to always come up with solutions to that, and we don't always have the resources or know of the resources to solve those problems too.
We've become the social workers out in the field where if things were in place and there was a focal point that would direct people exactly where they needed to go every time, whether it's through the hospital or through the health department, there needs to be a focal point where where one phone call is made and someone can direct someone who's looking for help to go in a direction.
And I'll just follow up with that. A lot of people won't call 911 or won't call law enforcement because they don't want to be Baker acted, or they don't want to have their parents taken away, their children taken away, whatever. So I agree with you. There are a lot of services out there. How do we get the information out there that this is who you can contact, instead of sitting there going through the phone list, because when you're in crisis, you're not going to do that. And also, are there any services out there as a community that we are missing that, you know, we can, Medicaid, you know, that's the government, and we know that we don't get our fair share of Medicaid in this state, let alone this county. However, that's a whole other fish to fry.
Sure.
Is there, are there services out there, and I'm sure there are, that we are not tapping into that we could get for our county? Through other groups?
Just a thought, like, there are a whole bunch of churches and religious organizations that have to come in contact with these people too. Is there a way for them to connect to the more government side?
So if I'm hearing you correctly, we have it on both sides. We don't have any place to direct calls to, and we would also have to educate all of the possible contact points to direct, to where to direct those calls. Yeah.
And I was just
maybe that's
thinking,
something we can work on building.
Your point is well taken. And what if, within the sheriff's department, within the dispatch, you had X employees per shift, so it's going to increase personnel.
Yeah.
Okay, that's a given. But they're the specialists that would handle these things. And instead of a 911 number, you could have another one, 912, something like that, where they would be able to handle the appropriate agency that might be able to help these people that are in distress.
That's exactly what I was in my head thinking, like, we could have like a 111 or, I don't know what it would be, but,
Yeah.
you know, and I don't know if the comm center would be the thing, or wherever it was housed, or however it worked, but I mean, if you could publicize that and get people to understand that if I'm having crisis or other issues, I don't have to call 911. I mean, 911 is for other emergencies and stuff, but if I'm having a situation where I need help with a child, where I need help with an elderly person, I need help with a vet, I need help with a homeless person, I could call this number that's well publicized and everyone knows, and you call it, and then they try to help you get the resource needed. I mean, I don't see.
Does anyone know of
Carrie, you
system
wanna-
like that
We
working?
actually have a system like that. SMA Behavioral, they have an 800 number, and they're funded in Volusia and Flagler counties for a mobile crisis response team for children up through age 25. So the system exists. We probably need more people to know about it and know what they're going to get when they call and feel comfortable calling. And potentially, it needs to be for all ages so that it's easier to direct everyone to the one number. But it is special funding that was appropriated by the legislature after Marjorie Stoneman Douglas to have these mobile crisis response teams, but only for children and for young adults. But that does exist.
So does all the points of contact, like the hospital and sheriff's
No, I mean,
department?
that's the challenging part, is there are so many places that people might go for that first help. It might be their church, it might be the hospital, it might be, you know, the lady down the street who knows everybody and everything. And you have to put the right information in all of those people's hands so that they understand what's there.
Why
so-
wouldn't every first responder not know that number,
Right.
or have that number, or know it exists?
Or even the 9/11 people, when they get the call, would say, this is something that I ought to know.
Take it out of a basket, there's a number you should, and they could interconnect on not the design or mechanics of it, but, and not to put any more on 9/11 dispatchers. But if somebody that doesn't know about that
Right.
availability calls 911, says, I have this problem, and then the operator or dispatcher or someone, and that would be an employee type situation, again with the sheriffs, but then you pull that out of the basket, if those people are educated enough, pull that out of the basket and say, I'm gonna connect you with so-and-so.
There's a metric right there. So that
Just on the comm centers, it would be extremely hard for the call center to do this type of work on the 911 center.
Absolutely.
To determine if that was a good feasible, because most of the time, they have to let a law enforcement go out to then vet it. You know, so it would be very hard to vet over the phone and get accurate and good assistance to people. It's a phenomenal theory, you know, so I do believe in the theory. I just know from 24 years of walking into the comm center that I think it would be a very hard thing to do
Yeah.
from that,
Yeah.
you know, that aspect.
I think that would be difficult.
But there are other ways that you could get that information
Yes,
out so that
yes,
people knew
absolutely.
before they dialed 911 that
Absolutely.
there was
But that's
another
only
number
for
to call.
25 and under, correct?
That resource, yeah.
That's-
Now, I mean, SMA's Access Center does help all, but that specific new capacity is for ages up through 25.
So
And-
sorry,
And on the goal of the RCO eventually will be a 24-hour. And if someone is overdosed and is taken to the emergency room, they would know, and they would have a list of what available beds there are. So when they get to the ER, they're released. The peer is sitting there saying, are you ready, are you ready? And then there's pre-registration done at a bed somewhere for recovery. So that is, because that is so emergent, if you don't catch them right then and there, they're gonna go home and just use again.
Right.
So that's gonna be the situation eventually, is yes, where can you send them, where's the next available bed? And that's not being done now. When we find someone, you probably don't know it, but they looked for 7 beds last weekend and had to go to Miami to get 7 people from Flagler help, that asked for help. So it's just not working.
And it's not a farce to think that they're gonna go in, overdose, and then go out and overdose again. It has happened.
Yeah.
Oh, yeah.
We've Narcaned people twice in one shift.
One day.
So that's not something that's like, oh, I think this could happen. It's happened.
So I definitely should have known that this group was immediately going to want to jump into solutions. And I know we're trying to keep it to an hour and a half, and before we run out of time, I really, if you were going to move to a community and you were doing your own research and you wanted to know what the wellness, the health and wellness of that community was, what kind of things would you be researching and looking at?
I'd go to the schools.
Yeah, schools, I
Not to
would-
put anything on the school.
Okay.
Guidance counselors, they should, after 30-some years in school, I did graduate.
Eventually.
Eventually. Thanks for that, Charlie. Seriously, the guidance counselors, I know I worked in the junior high school, 6 through 8, and then also worked in a high school. And the counselors themselves are the ones that we hope that the kids go to when they have a situation, whether it's bullying, or whether they're one end or the other of that, or whether it's a home situation and they don't have anybody, even grandma next door, they can't
Right.
talk to her. So does the school system have, because
So I want us to think about, so I don't mean to interrupt, but I want
Okay.
us to think about something just for the, for time purposes. The demographic of our suicide rate is middle-aged white men. So, and I'm not saying, I think it's great, the idea of looking at a metrics for school personnel as it relates to mental health, I think that's a great metric, and I think we should do it. School suspensions, definitely. Rate of bullying, yes. The rate of those participating in the trauma and the connection, the Handle with Care program, absolutely. But what other indicators really speak to the health of a community?
Crime statistics.
Crime statistics. What else? Unemployment, I'm thinking, right? Homeless rate. Maybe access to recreational opportunities. I would just, we're gonna run through this same agenda with community groups, but I'm really hoping at the end of the night tonight, we at least have some indicators that would be at least maybe possibly the beginning of either a dashboard or a report card. But what are those indicators? What are those measurements that say this community is well, this community is sick? We know, suicide rate is a given, right? Opioid overdose is a given. But what are some of those things you might not think about normally?
Could we
That
talk
would,
about quarterly reports from church organizations and things like that, that possibly keep records on how many people they're actually helping?
request for assistance.
Yeah.
Perfect. Perfect. Maybe request for assistance through social services at
Yeah,
the
like-
county.
Or
Or
like the
food
St.
handout.
St.
How
Vincent de
much
Paul
food are we
Society,
giving?
Yep.
I mean, they keep records.
Someone who goes to a church for assistance has to track that information somewhere.
Absolutely.
And, for me, it's a system problem. What do you do with that information? Well, we keep it in a file drawer. Well, that doesn't do anybody any good. So if we can get everybody who has some way touched a person who needed help, and they can write down what it is that they did, or come up with a systematic form that they just check the boxes and what they need to check. Now we're at least tracking the people of what they have performed and done. And then we could start getting further into the weeds and start finding out who those people are that needed additional help.
Very good point. And the other thing that Carrie had shared when she was going over the data, and I had leaned over to Commissioner O'Brien and I said, I wonder what that is really all about. And it was, I think, number 3, or 2, but it was access to alternative therapies,
Yeah.
right? So maybe that's another indicator. How many organizations within our community are available that offer alternative therapies, right?
What is that?
What is alternative therapy?
It could be things
Just
like
about anything.
massage, acupuncture,
Yoga, mindfulness,
yeah.
heart, mind, body.
Well, these respondents obviously felt that there was not a lot of access to it.
And we have some organizations providing that.
Absolutely.
But if it's only one, so
Well, you have several veteran organizations that provide support, such as the DAV. They have vehicles that they take veterans to long-distance appointments, for example, out in Lake Nona, and then down to Daytona.
So maybe the measurement is social and civic groups, right?
Yes.
Because community connection is a big piece of battling.
But
you know.
I also look at the population. Is this a vibrant community? Are we gaining or are we losing?
But how do you measure that, Colonel?
Well, you look
How do
at-
you measure this is a vibrant community? How do
Okay,
you measure that?
You measure by growth. Are we continuing to grow? Are there more and more houses? You look at the housing market, that's an indicator, okay? Are we constantly building, then that means people are moving in. Or you look at the number of homes for sale, people are moving out. So people see something and they want to hiacal out of the county or the city for some reason or other. So your realtors can give you that information.
Sure.
Yeah,
Karen?
in and out migration is measured annually.
Okay.
And
So we,
with
go
that,
ahead.
Angie, to also look at the business community
Oh,
group.
that's right,
And
yeah.
that whole
How
thing.
many
What's
vacant
here for
strip
people
malls?
to come to.
Also, how much the houses cost. Because if people
Yes.
can't afford it and they're drowning.
So affordable housing.
Yes.
Access to affordable housing. We mentioned the homeless rate. So access to affordable housing is an excellent indicator to take a look at. Good.
How about
And if you
a-
think of something
the amount
after
of
the meeting,
food
you
that's
can shoot
given
it to
out
us
by
too.
all our food pantries. People are substituting food pantries for paying a bill, so.
So access flagler numbers.
Access Flagler's one. There's food pantries opening up all over the place. There's churches now that they're giving them out of closets but we'll never identify every single food pantry, but I think Pastor's got the biggest one at Grace Community.
You know, and we also do Meals on Wheels.
Yeah, and there's a
Yeah.
Meals on Wheels
That's pretty
program.
significant program.
300, I think.
Yeah.
Yeah,
something
there was a
like-
survey request or question related to food insecurity, and it said, did you ever eat less because there wasn't enough money for food? 17% of people
Yeah.
said yes.
Yeah.
Do you ever worry your food would run out before you had more money to buy more? 18% said
Yeah.
yes, so food insecurity.
So my daughter was actually the director of Feeding America, and she said, we are a designated food desert. And we don't have real good access to the networks that would make it more readily available. So Orlando, Jacksonville would be folks that would be better suppliers, because we talked about it a little bit, but she said she could give people information for what the access points are and how you could set up a more universally available network that had better food, more regular food, and wasn't dependent on the other residents who are here, because Feeding America has those suppliers and donators, so. So if you want that, there's a point that you want that information.
John, Finelli, let me ask you a quick question. We're talking about food. What is the current policy with the Flagler County School Board with regards to a kid that doesn't have the funds to buy a lunch? Do we feed him?
Yes, of course.
Without
We're never gonna
question.
we're never gonna let any kid go hungry.
Okay.
All of our students in the county receive free breakfast. So everybody that wants free breakfast gets free
Well,
breakfast.
what about lunch?
And then we have a free and reduced lunch
Right.
program that they can apply for.
Okay.
But there's not a school in our district that's gonna
All
let
right,
a kid go
because
without a
you've
lunch.
seen the horror stories at other schools where they just, whoops, or they give you you don't get the
No.
regular
They
meal, you
get
get
the
the bread and water
regular-
type stuff, you know?
They get the regular breakfast.
Now,
And there is a policy, if they're there for after-school activities, they also get a dinner.
They get a dinner.
Yeah.
now here's a thought I had. You know, the city of Palm Coast is working on this Connect program where any citizen in Palm Coast can essentially contact the city, make a complaint, or get whatever information. And it's still growing. And I'm wondering, because we've got that technical structure involved, and I would like for my esteemed colleagues from the other smaller communities, if there's a way that you think hooking into our system, but tailoring it to the specifics of Flagler Beach and Bunnell and to Beverly Beach, because the system is there, if we could do something like that. And I just have to throw that out for entertainment, you know, to think about it, because it's senseless to have a system under this fiber optic cable that we all can't use.
Carrie, the ALICE statistics, can you just explain what those are?
Yeah, so ALICE is a term that United Way is using in Florida, where it's asset limited, income constrained, but employed. So they're individuals who are basically working poor. And if you combine the ALICE population with those living below the poverty limit, it's about half of our community in Flagler County. So ALICE population working, but one health issue, car breaks down, anything like that, they could instantly be below the poverty level, homeless.
How do they measure that, and how frequently do they do that?
They publish a report annually.
Annually?
Yeah.
Okay. So that really wouldn't help us on a
We could look at
shorter-term
the
metric.
algorithms they use to calculate it and see if some of that data is available more frequently. Because they look at things like the number of available and affordable rental units. Unemployment rate obviously is something that's measured much more frequently than annually. So some of those things we could look at.
Okay. So in honor of time, we probably attempted to bite off too much with this agenda tonight. But we've got a number of indicators that you have kind of recommended, or we've discussed somewhat. We'll gather additional indicators and metrics that community groups and stakeholder groups would be interested in tracking or would be beneficial in tracking. And Carrie, if you go to the next slide.
Just before we start, I just want to make a point. Everybody understands that the county provides the governmental social services, not the cities.
Right.
Mm-hmm.
That's right, that's your job.
Yep.
So that's
We do it.
And we do it well.
And
We
you
do it pretty well.
And you did.
Do a lot of that.
well. So here's the idea of collaboration amongst our entities, right? Across so this is not an issue or a topic that's going to be solved by just the county.
Correct.
And by just the county social services. We know that. That's just not possible. The idea that any one entity is going to solve this problem is unrealistic. It's going to take all of us working together along with the stakeholders and the community, right? That it will be brought into the conversation, because it's going to take everybody really tackling it and addressing it. As we kind of wrap up the night, 2 questions to really ask you to think about. One, are there initiatives, or are you willing to take back to your group to have a conversation about the possibility of, in your corner of the world, addressing this topic of mental health and wellness, some initiative, some activity, even if it is in the smallest scale, and you're just training your staff, right? It doesn't have to be a huge initiative. It can be a small initiative. But what part of this are you willing to maybe tackle? And then the last question would be, are you willing to come back on a quarterly basis, either have one individual appointed from your elected body along with a staff member in leadership to participate on an ongoing quarterly basis for this conversation, so that we can collaborate and we can work on these issues together. If it's not one, informing each other of what the others are doing, but 2, when the opportunities arise, to really be able to reach a hand across the table to say, hey, we can work with you on that. We could definitely support you on that. I know that Palm Coast was talking about doing a mental health symposium. And so that would be part of this whole driving conversation around removing the stigma and trying to identify resources and share those with the community. So those are really the 2 big questions as we wrap up the night. One, are you willing to identify a member of your elected body and a leadership administration, an individual who is in administration, to really attend and it can be more than one elected official, they'll always be noted, but attend on an ongoing quarterly basis so that we've all done a lot of talking about these topics, but how we can really begin to collaborate on some action plans, and what does that look like? And then making sure that we're communicating those things with the community. Because like I said, you know, if you look at this, there's a lot that's been done, but there's a lot that people don't know about.
I think if we look at the quarterly kind of process, there needs to be, it needs to be pared down. In other words, maybe just one quarter is just a discussion on one particular
Issue.
topic or issue. You know, just a thought.
So Colleen, to think about that, is there a place or a way to indicate who are the agencies, the fraternal organizations, the church, the faith organizations that are willing to participate? Because it's great for all the electeds to talk about all these things, but the people that interface and actually follow through, either as a receiver of information or just, you know, giving out services. And how do we make the table open for them? Because they're part of the conversation too about, you know, how the whole community works together. So I don't know if they have a network, a formal network, but how does this organization reach out to the community and say, if you'd like to be part of this?
So I know that and Carrie, I don't want to speak for you, but I know Flagler Cares will be inviting their membership already and opening it up to the community and running through a very similar agenda than we did tonight.
There are several groups that convene people from different organizations, and the county sponsors a resource council that meets every month, and they have topics that they discuss, and they have a pretty large roster: Flagler Cares, Flagler Lifeline. And there are other committees that get together. I think everybody kind of takes a little piece of the big system. So maybe it's finding a way to connect all of those active groups too, to make sure that we kind of cross-pollinate ideas. Because when you're talking about, you know, health and social issues, often it's the same individuals who have multiple challenges. So it's kind of hard to divide it up that way. So maybe a way to connect all of those. And I'm not sure, the faith community, I'm not sure how they convene in our community. But I think it would be really interesting to find out if they already work together in any organized fashion, or if they're interested too, if someone.
But they do meet in an organized fashion, because Lynette Schott and I presented to a group of them.
I'm going to invite them all actually to a meeting on the census here.
Yes.
You know, so I think that'd be a good way to get them all
Absolutely.
together and build a database too.
Right.
You know,
I was going to say, Commissioner, because you do have that list and people have been giving you names of different social organizations, faith-based organizations, that you're going to reach out to for the census. So Donnie's got the
Fits
list.
perfect. Yeah.
And that's all the heritage organizations too, the heritage organizations that we have, so that's all in
Yeah.
the same umbrella.
Yeah.
And are we also looking to have any providers from, whether it's allopathic or conventional or alternative?
Yeah, they're invited. You even have members of them in Flagler Cares.
Oh, okay.
Yeah. Yeah.
I think I have a thought to finalize what we've been through. If you want to get something done, don't invite the fire chief to come to a meeting, let the crews get the work done. And if you go with that premise, as I think one opportunity that we could take advantage of is having Carrie kind of mediate a discussion with all the people that work out in the field on, if they were given a blank check, they want to fix something. What would they do? How would they do it? How long would it take? And let Carrie orchestrate a meeting with the people that do it on the street so that they can come up with a final solution. And that is part of the recommendations. We can talk all day on what we're seeing.
Well, that's just it.
But the folks in the street and the folks that are dealing with this every day should have the opportunity to work with Carrie and come up with recommendations and present to the board.
Yeah, definitely, definitely. Okay, so we've got, I think, like 6 minutes left. So we're gonna go around just for closing comments, and we'll close out the night, and very much appreciate everyone taking the time to come.
In the school system, do we have student programs that, you know, there are a lot of smart kids in schools, and, you know, some of them become motherly even at an early age, and You know, do we have programs where other students could go to students?
Like a peer-to-peer.
A peer-to-peer or
We've talked
student?
about, we've talked about that, but we don't have it now.
Well, that might be a good idea too,
Yeah.
because first of all, kids talk to kids. Social media would be another way to get the word out of, you know, what help is out there for kids, so,
Right.
you know, I'm just thinking.
Okay.
There's been plenty of different programs
Informal,
floated
just
through.
not systematic.
Well, yeah, even through the Future Problem Solvers, they've gone through different anti-bullying and other support groups within some of their schools that could be replicated.
We do have pockets, it's just not system-wide, but system-wide approach might be something to
It
look
might be
at.
good that you have a, you know, bunch of students, so you have a lead student that can go to a guidance council or somebody else, you know, because
Right.
it starts young,
No,
you know?
Definitely.
And a lot of these young kids, I mean, we're all sitting here, you know, we're all either retired or have had good jobs, we all have health care. But it's the young families that aren't making a living in this community that have no health benefits.
Right.
And that's a key.
True.
I think we're blessed that we have additional folks this year because of legislation and bigger awareness in our schools. So everyone in our building is a contact point, and everyone is a networker. So it would be great for you to come in and learn about that.
Well, I was just thinking about my day job. I work at Florida Healthcare Plans. I always forget the plans on the end. And we have 2 facilities in Flagler County, and for someone who has that insurance, we do have diabetes programs and pre-diabetes programs and cholesterol reduction and weight loss and lifestyle modification and those kinds of things. But even people who have insurance don't really take
Use it,
advantage
right.
of that service, because if you have the insurance, those benefits are free. It doesn't cost you anything to come to a class or to see a dietitian. There's 6 dietitians on my staff at Florida Healthcare Plans, and 2 educators that are certified diabetes educators. So, you know, I'm thinking, when we're talking about the uninsured or the marginally insured, but we also have a population that's insured that is not taking advantage of what their benefits are. And I think part of the population here that we've talked about tonight are the nearly homeless and the homeless. And I think there's real issues there regarding how do people become homeless and what can we do to get them out, a hand up to move them back into. And that goes to the affordable housing, it goes to the food.
Or how to avoid becoming homeless.
Yes, but, you know, trying to prevent that. So I think there's a lot of that that just fits into all of this.
Right. Thank you. Eric?
Well, we definitely have our work cut out for us, going back and reviewing this list as a city, because there's quite a bit of pieces on here that are bite-sized, and there's something that even small municipalities can do. One of the things I noticed just in the presentation and brainstorming where the gaps are is the folks that need the help the most are usually the least educated about where to go to get the help. And I think that that's a big tool and an easy gap that can be closed. And, you know, you can even use, for instance, that Connect system that Jack talked about, or just a information campaign, because we're not there yet at the finish line as a county, but we do have a lot of tools in place. The problem is very few people know about where to go to get them. And just an easy layup will be to formulate some type of information campaign to push this out and get it to the people that need it. And I think that's something that all the municipalities can do pretty easy.
Right. Great. I take that as a commitment.
I guess maybe the comment that I would have at this point in time, this county is supposed to grow by, what, 30,000 within the next
15.
10 years.
Right. So, and I don't mean to imply that nothing has been done, but I think this is great that you're putting the correlation of everybody together, because as we increase the population, we're gonna need these services and ones we don't even know about yet.
Right.
So, I'm glad to be part of it.
Great, thank you for coming.
Yeah, I'm glad this is just taking place, because I've been in Flagler Beach 9 years as a commissioner, and we used to get together like this quarterly, and it kind of, I think it was a coffee landing thing, but it all fell apart. I don't know, but it fell apart.
Must have been the
It fell
airport,
apart.
said landing.
So anyway, I'm glad this is happening. I think it's needed. There's going to be lots of resources that we're going to need and that we don't have, that we know we don't have. But again, if we look like we're united and we're trying to do something, we can't solve every problem, but we're making an attempt.
Thank you.
Yeah, and I'll just piggyback on that. I know the mayors, we work well together, we meet quarterly. I would like to think that all the cities will pull together in the county for this because this is important. This is our population. And so, yeah, anything Flagler Beach can do, but let's all stay in touch, meet quarterly.
Great.
Go home, brainstorm. Usually my best ideas come to me at like 1 a.m. and then we.
I'll probably be awake.
Yeah, I'll call you.
Text me.
Text me. And, yeah, and then just bring back and what we've thought about, or just speak to the communities that we live in and find out what people want, what they need, and how we can do better for them.
Charlie?
I got something, I don't know if it fits in, but let me just say a few words about it. A while ago, this year, our fire people started taking a look at the number of ambulance calls that we had. People that were just looking to get out and take me to the emergency room so I can meet somebody, et cetera, et cetera. So what we did is we started to take a look and break those people down into, maybe we can go out and talk to them before they make that particular
Proactive,
phone
yeah.
call, and that's been working real well.
Yeah, I love that.
Good idea.
Okay.
You know, don't wait for something to happen.
Right.
You know, just get out there in front of
Makes
them.
sense. Commissioner Silva?
Well, I disagree. It's coordination. We have an awful lot of groups when you really go through it, and then private, public, and church. And I've said this for a number of years now, we just are not coordinated. And people say, oh, well, we did that, we have a list, and that kind of thing, but it's not coordinated. We're duplicating effort and wasting money in a lot of these ways we go about it. So I think that this is the kind of group, I think this is a coordination group.
Yeah.
It's not the group that solves the problem. It says, if you put this group of people together, they can solve this problem, and something like that.
Okay, great. Commissioner White?
I guess the biggest thing for me is it's a real honor that you would all come out and participate, and it's a testament to, I think, again, our community spirit and wanting to do the right thing for our respective communities and for the county as a whole. And so for that, I appreciate everybody coming. And I also just, again, want to thank Carrie, you and your team for organizing this, keeping us on track, and counties, and for county staff and I know, and for the clerk's office. I know you know it's late and it's a Thursday night already, and so again we appreciate your help to get all this together.
You still got to close stuff out too.
A lot. We really appreciate it.
Yeah.
Chief?
Well, you always have the commitment of the sheriff's office. I mean, we always, are excited to attend the events and listen and give our feedback. I mean, people are our business, let's face it. That is our business. That's our only business. And when you see people in crisis at 3 o'clock in the morning, we've seen it for, that's my whole life has been that, is talking to people in crisis who need help. And when I see a bunch of other people who probably have the answers to those, we just don't have it at 3 o'clock in the morning, but together in this room, you guys most of the time have it, and finding ways to bring that to the people so maybe they don't even see us. We'd like them not to see us, you know what I'm saying, for the most part. So, but the sheriff's office is always committed to these programs, and anything we can do and be a part of, well, you always will be, because this deals with our people.
Mr. Dance? Anything?
Sure, briefly. I'm just, after today, with the 2 meetings that we've been at, I'm just, proud of Flagler County and our residents. I heard a lot of important issues that were addressed, and we have a representative and a senator that have been very responsive to us and our needs. So it was enlightening to hear the community. And then even tonight, getting together around the table and discussing these needs and putting together a plan for the future. So I'm just excited about the future, that we can all together address these issues, and just excited for Flagler's, future. Thank you.
Thank you, Mr.
It's good. All of these comments remind me of one of our opening sessions at this beginning of school. And Colleen was on the stage talking about relationships. Relationships, it's all about relationships. And you have all committed to be in this relationship for the solutions. And that mantra has been what has happened in Flagler schools. More relationships at every level, more awareness of who our neighbors are, more awareness of what our neighbors need and what we can offer and who we can connect them with. So I think it's just, it's a beautiful thing to see everybody committed to that same thing, because when I first moved to Flagler, it seemed like pockets of small pie mentality. There's only so much. And in this way, everyone coming together, there's an amplification that makes it so much more than we individually have. So I appreciate everybody's comments, and I look forward to what comes out of this, and that the networks that go into the community that knows then that there are avenues. So it's not a, we don't know how to get this kind of situation. Very healthy direction. Thank you.
Colonel?
Well, my background as a Marine Corps officer in leadership has taught me that you can't do it by yourself. You have to rely on your troops. You have to listen to your troops. Sometimes they have some brilliant ideas. But more importantly, it's all teamwork. And that's why I want to work with all of you. There are no walls in my book. If you need me, I'm there for you. And I know Flagler Beach has a special place in my heart. That was the very first place I went to work when I retired from the Marine Corps and ran your ocean rescue. And I got a good education, as we say in Louisiana, about how government works. But, the bottom line is here, we don't need any of this infighting, and it's gone, thank God, because the two major players are gone. And I'm only sorry I wasn't there, because I ran.
Jeff, you're killing me.
I know. I ran to make sure that we could all work together.
All right, we are.
You know where I'm going.
I'm going to hug you after the meeting. Okay.
It's hard to follow, Jack.
It is what it is.
Change, in our opinion, you change culture one person at a time, and that's what I find. And I really can't wait to see what the opportunity is that we can give the people on the street and people on the front line, what they can come up with as direction. And this group should be the catalyst group that actually removes the obstacles. Whatever they're telling us, we got to tell them that we're going to remove those obstacles and let them get to work, because those are the folks that are the subject matter experts and know what needs to get changed. So thank you for the opportunity.
Absolutely. And Carrie, any final remarks?
May I speak?
No, I'm sorry, there's no public comment right now.
No, I just think we'll try to put all of this together and massage it a little bit and put it back out and come up with a plan to convene the rest of the community, to connect with the other sectors and bring that information back, so that, again, I think you're right. I think you guys are the obstacle removers once we identify what are our first steps.
Again, just want to thank you all, and I know the process was a little bit messy. We'll continue to process this whole, identifying metrics, identifying a report card with community groups, come back together. I think it might be best to keep the invitation open for the intergovernmental meeting, the next one, so that if multiple folks from the same board want to come, that's more than fine. I think we're definitely better when we're working together and in a collaborative way, so we're not duplicating resources or efforts. And I love the idea of us kind of helping to remove the no's and the obstacles so that those that want and can do many of those things to address community needs have the ability to do that. So again, just want to thank you all for coming tonight. Thank you for participating. Look forward to the next conversation. So again, thank you and have a safe travel home.
Thank you. Thank you. Really appreciate it.